Thank you very much, Speaker. And my question is to the Premier. New Democrats have a Pharmacare plan for everyone. It will cover 90% of prescriptions and no one is left behind. It is actually Pharmacare for everyone. Why doesn't the Premier believe in Universal Pharmacare?
Here, here. Acting Premier.
Speaker, Minister of Health and Long-Term Care.
Minister of Health, Long-Term Care.
Mr. Speaker, certainly our government is committed at the end of the day, hopefully, to have a national universal pharmacare program. Well, we on this side of the House, being the type of responsible government that we are moving incrementally towards that goal. And so, of course, we did announce our OHIP Plus program that started on January 1st of this year. Free drugs for everyone under the age of 25. The entire number of drugs is 4,400 drugs that are now covered. We believe this is an excellent step forward. Over 1 million prescriptions have already been filled, Mr. Speaker. This is the first step, and of course I'll elaborate in the supplementary.
Thank you. Supplementary.
Thank you, Speaker. Again to the Premier. I don't think incrementally is going to cut it. The Premier and the government have talked about Pharmacare, but the reality is the government has had 15 years to act. Why has this Liberal government ignored Pharmacare for the last 15 years?
Thank you. Minister.
Mr. Speaker, as I was saying, of course, we do believe in incremental improvement as a responsible way in terms of building our budget. And so, of course, we have now increased our coverage in OHIP Plus for all seniors over the age of 65. So there will be no copay, there will be no deductible. This will be of immense benefit, again covering all 4,400 drugs to ensure that no one is left behind. So we have a comprehensive plan. It's going to make a real difference to the health of the community. I do want to point out that the NDP's plan apparently won't take place. It won't be realized until the year 2020. Thank you, Mr. Speaker.
Final supplementary.
Thank you very much, Speaker. It surprises me that this government defends their junior drug plan and their senior drug plan, and it's not fair to call it Pharmacare when they don't actually care about anybody in between. The Premier thinks that children should have access to medication, also thinks that they should be cut off when they turn 25. New Democrats don't think so. We don't ask how old you are when you go to the hospital, so we shouldn't care how old you are when you need a prescription. Healthcare should be universal. For a person with diabetes or asthma or HIV or any other chronic illness, they should have drug coverage. They should have coverage on their 25th birthday, their 30th birthday, their 40th, their 50th, and it goes on. Everybody, Speaker, everybody. That is what universal means. So why doesn't the Premier believe in universal Pharmacare?
Good. Thank you. Minister.
And Mr. Speaker, I'm sure you will recall in our budget of this year we took a further step. We introduced coverage for those with no private insurance between the ages of 25 and 65 so that they will have 80% of their costs reimbursed for dental and pharmacare, $400 for an individual and $700 for a family of 4. This is an excellent step forward. More and more people are being covered. We have 1 out of 2 people in Ontario now covered for Pharmacare. Thank you, Mr. Speaker.